Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about puncture wounds. Puncture wounds are a common problem when it comes to the foot and ankle, especially the foot. You'll hear people that walk on something and they get something that goes through their shoe or into their foot. The fact that a lot of individuals are now walking around barefoot or in sandals or flip-flops increases the chance of this happening. But even in a tennis shoe or a boot, people are actually getting different types of puncture wounds. There are multiple different things you should consider if you have a puncture wound. Number one is you need to say, okay, what was the cause of the puncture? What exactly happened? Did you step on a nail? Was it a stick or a sliver or something like that? And then you need to figure out if there's any additional treatments that need to be done for that. For example, if you step on a nail, you need to treat it as a dirty wound, as a puncture that can actually be problematic. Nail that goes through a shoe, we start worrying about Pseudomonas as one of the causative mechanisms because of the rubber in the shoe that it went through. You also worry about the age and cleanliness of the nail and may have to consider your tetanus status based on that type of puncture wound. The other things you worry about is the depth of the puncture. So you actually start looking at it and say, okay, is this just through the skin? Does it go through the skin and injure bone? Does it go deep enough that you're actually worried about a deep pocket type infection, even a possibly anaerobic type infection where it can be closed off, and so anaerobic type bacteria that don't require oxygen can actually function and grow and make the wound significantly worse. All of that should be considered. If you're puncturing and you're getting down to bone, then you need to worry about whether you can get a bone infection as well. So we've just complicated it quite a bit, right? You say, okay, what was the cause? How deep did it go? And then the third thing you need to think about is, are you leaving any pieces of that in there? If it's a stick or something like that you stepped on, did you leave a portion of that as a sliver that sits in the body that can actually increase your inflammation and infection and so forth that needs to be removed? So puncture wounds can be very complicated. They can also be very, very simple. A lot of times with the puncture wound, you can literally just wash it out and watch it and protect it and treat it like any other wound and allow it to recover. But if it's a significant infection that comes with it, if it's a bone injury that comes with it, if you've got pieces of or fragments of the puncturing mechanism that are still inside, if it's deep enough that you're worried about additional injuries or additional infections, all of that changes and should be treated differently. Puncture wounds should be evaluated. They should be cleaned out significantly. You want to make sure that you get all pieces of the injury mechanism out. So if it's all pieces of the stick, if that's what you stepped on, you want to make sure that you're treating any possible additional infections like tetanus or Pseudomonas or anything like that. You also need to consider the fact that the skin has bacteria on it that could be injected into the body through such a puncture wound. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 143, Puncture Wounds. It is very important that with a puncture wound that it be evaluated, that not just be treated as any routine wound, but should be evaluated for depth, bone injury, and other types of infections that need to be treated. And as you do these three things, you can actually make sure that this wound heals without any problems, and you can continue